So here are some tips. This is new for me, and it's kind of hard to get all your ducks in a row with a lot of things, and especially when it comes to work stuff. Um, I'm going out of the country to have my surgery done. I know a lot of people elect to have it done here. Unfortunately, the insurance that I'm under does not cover bariatric surgeries. So I'm going to be going out of the country. I'm going out of Mexico to have it done. Um, Here, I live in Florida, and the doctors here, if you're self-pay, it's almost $20,000. It's like 18,000 something to have the surgery done here, and I'm not rolling like that. I mean, I could probably max out some credit cards and do that, but I figured that's just not a valuable option for me. And I don't know, I'll catch flack for it. I'm sure someone will say, but dude, you're going down to another country, man. What if something happens? They'll steal your kidney or something. Literally, when you do your research and you find a reputable company, just do your research. Do what you need to do. Talk to people that have done it out of country. The place that I'm going to, I've had a friend do it, and they came back absolutely amazing. Had nothing but really great things to say about this surgery center. The patient care there is amazing. I found out in the United States, some doctors, after they perform this surgery, it's an outpatient surgery. They wait till the anesthesia wears off, they walk you around the hospital, make sure you're okay, and then they let you go and you do the recovery at your home. This place in Mexico, it's 4 days. You get there, you spend the night in a hotel, you do the hospital tour, they do your x-rays and your blood work, and then the next morning you have your surgery, and then you have 3 days of recovery, I think, and then they do like 3 separate leak tests. They make sure the incisions are doing good, they make sure your pain management is okay. It's not like where they just do the surgery and they tell you, okay, have a nice day, go home and rest. It's not like that. You're under 24-hour supervision. You've got nurses that are there to help you out. But the things that I'm finding out most, that are challenging is like paperwork and stuff, with dealing with work and FMLA and, your primary care physicians and aftercare. You got to set up aftercare so that way you have a doctor to go to. Now, I made the mistake of going to my primary care physician to have him fill out my FMLA paperwork and my short-term disability paperwork. And he's like, dude, I don't do this stuff, man. I'm not the one that's doing this surgery, so you got to do this stuff through the person who's doing the surgery. And I'm like, dude, these people are down in Mexico, man. Do they even deal with United States laws and FMLA and stuff like that? And the answer was yes. They are the ones that are going to be filling out the paperwork, getting in contact with my short-term disability, blah, 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 stuff like that. But your bariatric person that you pick for your follow-up care, because that's super important. You got to have somebody that knows what you're going through when you get back from having your surgery, if you decide to go out of the country to have this surgery done. So you definitely want to have your ducks in a row before you go down and have surgery in another country. You want to have something to fall back on when you get home. So that doctor will not fill out your FMLA paperwork. They will not fill out your short-term disability paperwork. They won't do that for you because, once again, they are the ones that are not doing your surgery. They are the ones that are going to be doing your aftercare. So it is important to get your ducks in a row before you go down to another country and have this surgery done. So I've got about 2 weeks left. Just got off the treadmill and working on this little diet thing, because you got to make sure that your liver is smaller than it was going in. That way the surgery is, I don't want to say less dangerous, but it's more dangerous if you have a big old fatty liver in the way and they're trying to get around it, and it just could cause complications. But anyways, I'll talk about that later. But I just want to give you guys an update on paperwork and getting your ducks in a row before you go down to have surgery. I should have done this a long time ago. I was under the impression that my primary care physician would handle my aftercare when I got home, because the surgery's already done. It's more now about, pain management and stuff like that. But they're not going to do it, man. You have to have a bariatric surgeon or a doctor that will follow up with your aftercare. And that's about it. So I'm going to go hit a protein shake and get back to doing what I need to do. And I'll keep you guys posted. And once again, about 14 days pre-op. So that's where we're at. So get your ducks in a row, man. Take care.